When taking a critical look at issues facing juveniles in the criminal justice system, one can see many glaring flaws that need to be addressed. The overall effectiveness of the system can easily be called into question, with juveniles going into detention centers and re-entering society having received no rehabilitative services and relapsing back into criminal behavior. The system has been notorious for both juveniles and adults for failing to address offenders with serious addictions properly and not providing them with proper services. Another issue that is commonly overlooked is the co-occurring mental illness that often comes with substance abuse issues. The generalized detention system that has become the main form of rehabilitation in the United States cannot possibly provide the proper services to treat these individuals with dual diagnoses, and therefore do nothing but throw unprepared individuals and juveniles back into society. A youth program that has taken a completely different approach to youth rehabilitation is the Muirwood Trusted Teen Treatment Institution. Muirwood consists of two different facilities: a boys' residential treatment facility in Sonoma County, California, and an outpatient program in San Rafael, California. Each one offers highly individualized and structured programs to help youth with substance abuse issues treat their addictions and their co-occurring mental illnesses. The larger of these two operations is the boys' residential program, and it contains many services that distinguish it from the most rehabilitative juvenile centers. Services include group and individual therapy sessions, fully trained medical staff to run medicinal and psychological evaluations, medication management for anxiety and depression, and certified educational staff to provide classes for residents to take while they are residing at Muirwood so they do not fall behind in school. The boys' residential program takes boys from 12 to 17, and they only take a maximum of 10 boys at once. And the reason for them only taking 10 boys at once is so they have the opportunity to create a highly individualized and highly specialized program so they can focus on all of their patients equally and meet all of their needs. This allows them to have a seamless reentry into society, with them not only receiving their education, but to also visit their family, so they are not totally isolated while they're staying at Muirwood. This outpatient program in San Rafael serves both boys and girls between the ages of 12 through 19, and offers a similar experience of a highly structured, focused, and individualized treatment program that offers many services to help juveniles overcome their addictions as well. These include family, individual, and cognitive therapy sessions, as well as medication management and psychological testing. I believe this is one of the better modes for rehabilitation, since it allows for a group of highly specialized individuals to cater to the needs of a small group of juveniles whose needs can be recorded and provided for accurately. This allows for the often ignored co-occurring illnesses to be treated for properly and for a smooth transition to be achieved back into society. As discussed in Amanda McMaster's Effective Strategies Preventing Recidivism Rates Among Juveniles, which was a study to see which juvenile youth programs did the most to reduce recidivism rates, the most successful programs are based on interventions that are intense, involving frequent contact with the offender, sustained, which involves continuous supervision for a substantial period of time, holistic, which covers several aspects of the juvenile's life. Much like Muirwood, the treatments that were the most effective were the ones that focused on many aspects of the individual's life and allowed them to have a very intensive and unique experience that addressed all of their needs the way that they needed to be met. It was not the programs that isolated or attempted to scare kids away from crimes. It was the ones that were individualized that were the most rehabilitative. Another study called Reducing Juvenile Recidivism Through Specialized Reentry Services, the Second Chance program, reached similar conclusions and found that juveniles who went through conventional treatment methods, such as juvie itself, with minimal attention to co-occurring illnesses and addictive substance abuse services, were 2 times more likely to recidivate than those who went through a specialized rehabilitative program. Although these methods have been proven to be more effective, as clearly shown in the data, it is hard to implement them, for they are time-consuming to create individualized programs and very expensive to implement, since many of those who administer this kind of treatment must be highly specialized to do so. And with many establishments already struggling to provide adequate care for all of the individuals already, it's hard to imagine that changes will be brought in soon. It could take many years to build up infrastructure to put in this kind of treatment, but I believe rehabilitation centers like Muirwood are a step in the right direction.